Hello everyone, this is Dr. Simone Atkinson again, here with another video with NCLEX preparation questions. This is to help you review and identify whether or not you know your content. So again, to save time, I have made these questions and answers that will have our assistant AI help us to read to you so that you can identify what you do not remember related to psychiatric nursing. Good luck and let's get started.
What should the nurse prioritize when monitoring bulimic patients? The nurse should prioritize monitoring bulimic patients during and after meals to assess for signs of binge eating and purging behaviors, such as self-induced vomiting or the use of laxatives or diuretics. What are some symptoms of tardive dyskinesia? Symptoms of tardive dyskinesia include unusual movements of the arms, legs, face, and body. Can you provide an example of displacement? Displacement is when someone directs their emotions or behaviors toward a less threatening target. For example, if a person is angry at their boss at work and comes home and yells at their spouse, this is an example of displacement. What is a common behavior exhibited by patients with PTSD? Patients with PTSD often tend to blame themselves for traumatic events. It's important to reassure them that it wasn't their fault. Describe extrapyramidal side effects, EPS. Extrapyramidal side effects, EPS, can include various reactions like acute dystonic reaction, akathisia, drug-induced Parkinsonism, akinesia, tardive dyskinesia, and neuroleptic malignant syndrome. What type of diet is recommended for a client with major depression and severe weight loss? A client with major depression and severe weight loss should be placed on a high-calorie and high-protein diet, along with easy-to-chew, energy-efficient foods. Small, frequent meals are recommended. What are the dietary restrictions associated with MAOIs, e.g., selegiline, phenelzyne? Patients taking MAOIs should avoid foods high in tyramine to prevent a hypertensive crisis. What are the 5 basic components of cognitive behavioral therapy, CBT? Cognitive behavioral therapy, CBT, includes education about the patient's disorder, self-observation and monitoring, relaxation techniques, cognitive restructuring, and behavioral strategies. What are some common behaviors of a bulimic individual? Behaviors of a bulimic person often include binge eating, self-induced vomiting, enema or laxative use, and intense, frequent exercise to compensate for their binge eating episodes. What signs of bulimia might someone notice in an affected individual? Signs of bulimia that someone may notice include the individual going to the bathroom after meals, large food quantities disappearing, hidden wrappers, exercise routines, parotid gland enlargement, calluses, and a preoccupation with weight, food, and dieting. Do individuals with anorexia or bulimia tend to experience weight loss or gain? Individuals with anorexia tend to experience weight loss, while those with bulimia often maintain their weight or experience fluctuations, but may not exhibit the severe weight loss associated with anorexia. What symptoms are typically seen in major depressive disorder? Major depressive disorder symptoms may include a loss of appetite, weight loss, and disturbances in sleep patterns. What are the 2 clinical features of major depressive disorder? The 2 clinical features of major depressive disorder are a persistently depressed mood and a loss of interest or pleasure in almost all activities. What is the normal range for lithium levels? The normal therapeutic range for lithium levels in the blood is 0.6 to 1.2 milliequivalent per liter. At what lithium levels is it considered toxic? Lithium levels over 1.5 milliequivalent per liter are considered toxic. Regular blood level monitoring is necessary for patients taking lithium. How much fluid should a client taking lithium drink daily? Clients taking lithium should drink 1-2 liters, approximately 4 to 8 cups, of fluid daily to help maintain stable lithium levels. How does sodium level affect lithium therapy? Low sodium levels can contribute to lithium toxicity, so maintaining normal sodium levels is essential. What can cause lithium toxicity in a patient taking lithium? Lithium toxicity can occur due to factors such as dehydration, decreased renal function, following a low-sodium diet, and drug-drug interactions, particularly with nonsteroidal anti-inflammatory drugs, NSAIDs. What is the therapeutic approach when communicating with a delusional client? When communicating with a delusional client, it's essential to focus on their feelings and gently reinforce reality, avoiding direct challenges to their delusions. What are delusions of reference? Delusions of reference occur when individuals believe that external stimuli or events have personal and significant relevance to them, interpreting these stimuli as directed specifically at them. What is somatic delusion? A somatic delusion is when a client believes they have a physical defect or disease when no medical evidence supports this belief. What is persecutory, paranoid, delusion? Persecutory, paranoid, delusion is the belief that one is being treated in a malicious or harmful way by others. What kind of environment do autistic kids need? Autistic kids often benefit from a private and calming environment with minimal stimulation to reduce sensory overload. Signs of lithium toxicity include: Signs of lithium toxicity include GI side effects, primarily nausea, vomiting, and diarrhea. What is imipramine? Imipramine is a tricyclic antidepressant. Risperidone, what is the drug class and what is it used to treat? Risperidone is an antipsychotic used to treat schizophrenia and bipolar disorder. What are some potential side effects of antipsychotic meds? Potential side effects of antipsychotic medications include extrapyramidal symptoms, anticholinergic effects, orthostatic hypotension, sedation, tardive dyskinesia, and neuroleptic malignant syndrome. When a patient is taking lithium, be careful when taking which medications in addition because they can increase lithium levels and lead to toxicity. When a patient is taking lithium, be careful when taking thiazide diuretics, NSAIDs, and antidepressants, as they can increase lithium levels and lead to toxicity. What should a patient know when taking lithium regarding electrolytes? When taking lithium, it's essential to maintain sodium levels because low sodium can lead to lithium toxicity. Patients should get adequate sodium and drink 2 to 3 liters of fluid daily. What is the therapeutic level of lithium? The therapeutic level of lithium is 0.6 to 1.2. Over what number is lithium considered toxic? Lithium is considered toxic when levels are over 1.5. What are some lithium toxicity symptoms? Some lithium toxicity symptoms include acute GI disturbances, while chronic toxicity may manifest as neurological symptoms like ataxia, confusion, and tremors. A bipolar patient comes in and is experiencing acute mania. What is the priority? When a bipolar patient comes in experiencing acute mania, the priority is addressing physiological needs, such as imbalanced nutrition, because physiological needs take precedence. Name Maslow's hierarchy of needs. Maslow's, P.S., I love you physiological, safety, self-actualization, love and belonging, self-esteem. Having a patient bring their meds to each appointment is the appropriate thing to do? True, having a patient bring their meds to each appointment is the appropriate thing to do. Interventions to care for an anorexic patient include: Interventions for anorexic patients include determining their daily calorie requirement, monitoring weight at the same time every day with the same scale and amount of clothing, limiting exercise initially, reflecting on triggers, and avoiding encouraging a food log that may contribute to the patient's obsession with food. With bulimia, which gland is swollen? With bulimia, the parotid gland may become swollen. What types of drugs are used to treat ADHD? Stimulants like methylphenidate, Ritalin, and dextroamphetamine, Adderall, are commonly used to treat ADHD. What is the brand name for methylphenidate? The brand name for methylphenidate is Ritalin. What are some side effects of stimulants such as Ritalin? Stimulants like Ritalin can have side effects, including decreased appetite and weight loss, hypertension and tachycardia, elevated heart rate, restlessness or insomnia, vocal/motor tics, and the potential for addiction and misuse. What are early and late symptoms of acute lithium toxicity? Early or acute symptoms of lithium toxicity can manifest as gastrointestinal disturbances, such as nausea, vomiting, and diarrhea. In contrast, late or chronic symptoms may include neurological manifestations like ataxia, lack of coordination, confusion, tremors, and symptoms related to diabetes insipidus, such as polyuria, excessive urination, and polydipsia, excessive thirst. Many people use St. John's wort to treat. Many people use St. John's wort to treat depression. What medications does St. John's wort interact with? St. John's wort can interact with various medications, particularly antidepressants like SSRIs, selective serotonin reuptake inhibitors, SNRIs, serotonin norepinephrine reuptake inhibitors, and MAOIs, monoamine oxidase inhibitors. This interaction can increase side effects and potentially lead to serotonin syndrome, characterized by symptoms like shivering, diarrhea, muscle rigidity, fever, seizures, tachycardia, hypertension, and agitation or restlessness. What are patient care interventions for an acute manic episode? Patient care interventions for an acute manic episode include reducing environmental stimuli, providing a calm and quiet environment with low lighting, limiting personal contact, engaging in one-on-one activities instead of group activities, following a structured schedule of activities to maintain focus, involving physical activities to expend excess energy, offering high-protein and high-calorie finger foods, and setting clear limits to maintain safety. What drug class is fluoxetine? Fluoxetine belongs to the drug class of antidepressants known as SSRIs, selective serotonin reuptake inhibitors. What is characteristic of antisocial personality disorder? Antisocial personality disorder is characterized by a disregard for rules, a history of irresponsible behavior, and a tendency to blame others for their actions. Setting limits and making the individual aware of rules and acceptable behaviors are important components of care. Should bulimic patients be allowed to keep a daily diary in the hospital? Yes, bulimic patients can be allowed to keep a daily diary in the hospital. This can help them keep track of the amount and type of food they consume, providing insights into their behaviors and aiding in their treatment. What was the childhood of someone with NPD, narcissistic personality disorder? Children with narcissistic personality disorder may have experienced a sense of inferiority, poor self-esteem, and self-criticism during their childhood. What does a sense of inferiority, poor self-esteem, and self-criticism cause clients with NPD, narcissistic personality disorder, to do? Clients with narcissistic personality disorder may try to regulate their self-esteem as a response to their underlying sense of inferiority and poor self-esteem. People with narcissistic personality disorder try to maintain what? People with narcissistic personality disorder often try to maintain their self-esteem. What is the standard treatment for drug overdose? The standard treatment for drug overdose often involves the administration of activated charcoal to absorb the toxic substance. However, activated charcoal is ineffective for certain substances like lithium, iron, and alcohol, which may require specific treatments. What drug class is aripiprazole, Abilify? Aripiprazole, Abilify, belongs to the drug class of antipsychotics and is used to treat conditions such as schizophrenia and bipolar disorder. What is transference? Transference occurs when a client unconsciously transfers feelings and behaviors related to a person from their past onto the nurse. An example would be when a client feels that the nurse reminds them of their sister. What is countertransference? Countertransference is when the nurse unknowingly displaces feelings and behaviors from the nurse's past onto the client, which can influence the therapeutic relationship. If a schizophrenic is hearing voices, should the nurse always assess what the voices are saying? Yes, when a schizophrenic is hearing voices, the nurse should assess what the voices are saying. This is important for evaluating the content of the hallucinations and understanding the client's experiences. Is offering two choices beneficial when working with patients who have ADHD? Yes, offering two choices can be beneficial when working with patients who have ADHD. It helps limit the need for making too many choices, making decision-making more manageable for individuals with ADHD. What are the three main symptoms of ADHD? The three main symptoms of ADHD are hyperactivity, impulsiveness, and inattention. What is the priority when a client has suicidal ideations? The priority when a client has suicidal ideations is to assess whether they have had thoughts of self-harm, determine if they have a plan, and inquire about the details of that plan to evaluate the level of risk. Name a side effect of SSRIs. One common side effect of SSRIs, selective serotonin reuptake inhibitors, is sexual dysfunction. What are delirium tremens? Delirium tremens, DTs, is a severe form of alcohol withdrawal syndrome characterized by symptoms such as shaking, confusion, hallucinations, and other neurological and psychological manifestations. It can be life-threatening and requires medical attention. What are individuals with borderline personality disorder at risk for? Individuals with borderline personality disorder are at a very high risk for suicide. They often make suicide threats, especially when they feel abandoned or distressed. Patients with Alzheimer's and other forms of dementia may wander or get lost, so what precautions are important in the home? To prevent patients with Alzheimer's or dementia from wandering or getting lost, it's important to take precautions in the home, such as placing locks on doors above or below eye level since peripheral vision may be impaired, installing alarms on doors, disguising exit doors, and using child-proof doorknobs. The goal is to prevent them from leaving the home without supervision. What is electroconvulsive therapy, ECT? Electroconvulsive therapy, ECT, is a medical treatment primarily used for severe major depressive disorder with psychotic features or when patients are highly suicidal and not responding to medications. During ECT, electrodes are applied to the scalp, leading to a brief controlled seizure. The procedure is conducted under general anesthesia and with the administration of a muscle relaxant. ECT is used when immediate intervention is necessary to keep patients safe. What are common side effects after ECT therapy? Common side effects after ECT therapy include confusion and memory loss. Expected side effects of lithium include? Expected side effects of lithium include drowsiness, weight gain, dry mouth, and gastrointestinal upset. Lithium and sodium are closely related in the body, so keep their levels normal. True or false? True. Lithium and sodium levels in the body are closely related, and it's important to maintain their normal levels. Lithium toxicity occurs with dehydration and hyponatremia, so what should you do if taking lithium? If taking lithium, it's important to drink plenty of fluids, around 2 liters per day, and ensure adequate sodium intake in your diet. Avoid taking NSAIDs or thiazide diuretics while on lithium. What is rationalization? Rationalization is a defense mechanism in which a person explains their actions or behaviors by providing logical or reasonable excuses or justifications. What is projection? Projection is a defense mechanism where an individual attributes their thoughts, feelings, or impulses to someone else. What is displacement? Displacement is a defense mechanism in which a person transfers their emotions or behaviors from one person or situation to another. What is regression? Regression is a defense mechanism characterized by a return to a previous level of development or behavior that is less mature or more infantile. What is reaction formation? Reaction formation is a defense mechanism where a person behaves in a manner or expresses feelings that are opposite to their true feelings. Rotate staff members with borderline personality disorder patients. True or false? True. Rotating staff members when working with patients who have borderline personality disorder can help maintain a consistent and structured approach to their care. When a patient is on methylphenidate, what do you measure? When a patient is on methylphenidate, it's important to measure their blood pressure and monitor their weight and height. Methylphenidate can lead to decreased appetite, potentially causing weight loss, and it can also lead to hypertension and tachycardia. Use clear and simple sentences when speaking with an Alzheimer's client. True or false? True. When communicating with an Alzheimer's client, it's important to use clear and simple sentences to enhance their understanding and reduce confusion. What are the two major clinical features of major depressive disorder? The two major clinical features of major depressive disorder are a persistently depressed mood and a loss of interest or pleasure. To diagnose major depressive disorder, one of these two symptoms must be present daily for at least 2 weeks. Clozapine, use, and major side effect? Clozapine is used for the treatment of schizophrenia. One major side effect to monitor for is agranulocytosis, which requires regular monitoring of complete blood counts, CBC, and absolute neutrophil count, ANC. Describe delirium in older adults. Delirium in older adults is characterized by behavior changes and confusion that require assessment by the nurse. It often has an acute onset and is usually reversible. Delirium in older adults can be caused by medications, infections, hypoxia, and other factors. If an older client is experiencing acute delirium, the priority nursing action is to assess what is causing it and then to intervene. True or false? True. If an older client is experiencing acute delirium, the priority nursing action is to assess the underlying cause of delirium and then take appropriate intervention measures. Describe and give nursing action for serotonin syndrome. Description: serotonin syndrome is a potentially life-threatening condition resulting from an excess of serotonin, often due to interactions between medications. Nursing actions: recognize symptoms e.g., agitation, muscle rigidity, fever, rapid heart rate, discontinue offending medications, provide supportive care e.g., intravenous fluids, and possibly administer medications to control symptoms. Encourage patients with PTSD to talk about the experience and discuss the trauma at their own pace. True or false? True. Encouraging patients with post-traumatic stress disorder, PTSD, to talk about their traumatic experiences and discuss the trauma at their own pace can be helpful in their recovery. This should be done without causing high levels of anxiety. Describe PTSD characteristics in people. People with PTSD may exhibit characteristics such as flashbacks of the traumatic event, a persistent angry or fearful mood, difficulty concentrating, and feeling detached from others. Symptoms of someone suffering from PTSD. Symptoms of someone suffering from PTSD may include experiencing flashbacks or nightmares of the traumatic event, physiological responses like a rapid heart rate, sweating, and other stress-related reactions. They often avoid reminders of the trauma, feel detached and numb, have difficulty sleeping, and experience anger and concentration difficulties. What are the 3 main categories a person with PTSD has? People with PTSD typically exhibit symptoms in 3 main categories: re-experiencing the traumatic event, avoiding reminders of the trauma, hyperarousal, e.g., hypervigilance, increased startle response. What are the 2 core symptoms of antisocial disorder and autism? The 2 core symptoms of antisocial personality disorder are abnormalities in social interaction and communication, as well as patterns of behavior, interests, and activities. For autism, these 2 core symptoms involve difficulties in social interaction and communication. What is negativism? Negativism refers to a behavior in which a client resists instructions or attempts to be moved, often displaying opposition or resistance to what is asked of them. What is waxy flexibility? Waxy flexibility is a condition where a patient's limbs remain in the same position in which they are placed by another person. It's often observed in catatonic states, and the patient doesn't actively resist movement but instead maintains a passive and waxy posture. What does catatonic mean? Catatonic describes a state in which a client remains in a fixed stupor, refusing to move about or perform activities of daily living, ADLs. They may remain mute, exhibit bizarre postures, and be unable to meet their basic needs for adequate fluid and food intake, putting them at risk for dehydration and malnutrition. What safety measures should be taken for Alzheimer's care in the home? Safety measures for Alzheimer's care in the home include using keyed deadbolts, wearing a medical bracelet, removing clutter and throw rugs to prevent falls, and installing grab bars in showers and bathrooms. Household hazards should be removed. What is St. John's wort commonly used to treat? St. John's wort is commonly used to treat depression. What should be considered when using St. John's wort? It's important to be cautious when using St. John's wort because it interacts with many prescription medications. What is melatonin used for? Melatonin is used to regulate sleep and wake cycles. It can also help the body adjust to time zones and treat jet lag. When should melatonin be taken? Melatonin should be taken when you arrive at your destination. It's recommended to take a low dose for a short time. What is refeeding syndrome? Refeeding syndrome occurs when a starved and severely malnourished person finally gets fed via any route. It leads to disturbances in electrolytes, including rapid declines in phosphorus, potassium, and magnesium. What are the key signs of refeeding syndrome? Key signs of refeeding syndrome include imbalances in ppm, phosphorus, potassium, magnesium, and fluid overload. How does the nurse prevent refeeding syndrome? To prevent refeeding syndrome, the nurse should get baseline electrolytes, initiate nutrition support cautiously with hypocaloric feedings, closely monitor electrolytes, and increase caloric intake gradually. What is the therapeutic range for lithium? The therapeutic range for lithium is 0.6 to 1.2. When are lithium levels considered toxic? Lithium levels are considered toxic when they exceed 1.5. What is the recommended fluid intake when on lithium, and why is adequate sodium intake important? Individuals on lithium should drink 1 to 2 liters of fluid daily. Adequate sodium intake is important because lithium and sodium levels are closely related. It's also recommended to avoid NSAIDs with lithium, as they can decrease renal blood flow. Which specific vitamin deficiency are chronic alcohol abusers at risk? Chronic alcohol abusers are specifically at risk for thiamine deficiency. What can inadequate thiamine lead to? Inadequate thiamine can lead to Wernicke encephalopathy, characterized by altered mental status, oculomotor dysfunction, and ataxia. It can also lead to seizures. How are gross tremors and seizures from acute alcohol withdrawal typically treated? Gross tremors and seizures in acute alcohol withdrawal are treated with benzodiazepines such as lorazepam and diazepam. If a sibling has autism, what is the likelihood of another sibling having it too? It is true that if one sibling has autism, there is a higher chance that another sibling may also have autism. What is clozapine? Clozapine is an atypical antipsychotic medication. What is it used to treat? Clozapine is used to treat schizophrenia. What patient teaching is essential for those undergoing electroconvulsive therapy, ECT? Patient teaching for ECT includes fasting for 6 to 8 hours before the procedure, understanding that anesthesia and muscle relaxants will be given, awareness that the patient will be unconscious during the procedure, avoiding driving afterward, and being prepared for temporary memory loss and confusion during the immediate recovery period. Anticonvulsants should be discontinued as the treatment induces a seizure. What is tardive dyskinesia? Tardive dyskinesia is a condition characterized by involuntary movements, such as facial, tongue, and trunk movements, that the individual cannot control. What is neuroleptic malignant syndrome? Neuroleptic malignant syndrome is characterized by symptoms including fever, muscle rigidity, and altered mental status.